The first day I went in to shadow him, he has this lady on the bench, and she was there because she was having really terrible migraines
Okay.
to the point that she had to wear glasses because it was blurring her vision so badly.
Mhm.
He adjusts her, she gets off the table, and she takes her glasses off. She's like, "Oh my gosh, I can see."
Real Talk with Star Scorpio, episode 114. Today I'm joined by Dr. Mark Morningstar, a clinician and author known for his work in integrative scoliosis care. He specializes in comprehensive spine treatment that looks beyond just the curve of the spine, focusing on how overall health, nutrition, and other factors influence long term outcomes. We're breaking down what scoliosis really is, common misconceptions, and how a more personalized approach can change the way we think about spine care. Dr. Morningstar, welcome to Real Talk with Star Scorpio. How are you doing today?
I'm very well, sir. Thank you for having me.
Hey, I thought this would be an informative podcast. For episode 114, I'm glad to do this because I've interviewed so many people, different professions, entrepreneurs, singers, comedians, you name it. But this is something I always wanted to hear. First off, I want to actually ask you. I worked with someone about 20 years ago. This guy's name was Alex. We used to go clubbing and everything. And sometimes when I seen him at work, he would be walking with not a limp, it was kind of a hop. And his spine, like his back, you could see it through his clothes. It was kind of curved and it would make him do this hop. And then I asked him what was wrong, and I'm sure he told me it was a condition, but I can't remember if it was scoliosis because of course there's many conditions out there, but I don't know how to narrow it down. Maybe you could tell me. But he would often tell me when he went to the chiropractor he would feel much better, and then you can see the adjustment, like it wasn't that curved. I think it's an S or a C, but he did feel better after treatment. Is this correct? It could have been scoliosis.
It could have been, absolutely. That is a very common consequence of having a curve. Absolutely.
Hmm. Okay, and now for you, what led you to this path? Tell me about your clinician journey and what led you to specializing in scoliosis and spinal care.
Sure, sure. So I initially started out. So funny story. I was actually going to be a dentist first,
Oh, really?
and so during my undergraduate years, actually it was my fourth year in undergrad. I started working for a moving company.
Hmm.
And long story short, I was helping with a teammate. We were carrying a small piano down a flight of stairs, and I was on the bottom, and the guy up top slipped. And even though it was only momentary, for those couple of moments, I was holding the whole piano.
Hmm.
And I felt something pop in my back at that point, but of course I'm, 21 at the time or something. Didn't really notice much at the time, but the next day I couldn't get out of bed. And because it was an on-the-job kind of an injury, I had to go to the company's doctor that they use for all their work comp injuries. And this doctor happened to be an osteopath.
Hmm.
And so, my friend kind of like helped, almost carried me into his office. And this osteopath adjusted me, and then he gave me like a shot of a steroid or something just for pain.
Okay.
And it was the first time I'd ever been adjusted by anybody. And this doctor tells me, he says, "Well, if you feel like this helped by this time tomorrow, I want you to go see a chiropractor."
Hmm.
And I was like, "Really?" Because I came from a small town where all chiropractors did was voodoo.
Yeah.
I mean, they were like witch doctors, right? All they ever did
Yeah.
was hurt people, and I'm not sure how they ever even stayed in business. But
Okay.
they had a really bad reputation for my small town.
Hmm.
And so I went because I had to, because the company was paying for me to go, or otherwise I couldn't work. And so I went to this chiropractor, and after a few times of just, getting worked on and feeling better, like pretty immediately,
Hmm.
I asked him, I just said, "Do you mind if I kind of shadow you?" And the first day I went in to shadow him, he has this lady on the bench, and she was there because she was having really terrible migraines
Okay.
to the point that she had to wear glasses because it was blurring her vision so badly.
Hmm.
And at that point, he adjusts her. She gets off the table and she takes her glasses off. She's like, "Oh my gosh, I can see."
Wow.
And she looks at me, almost like looking like right into my soul, and is like, "This man is God," meaning this chiropractor. And then like instantly, it like hit me like a bolt of lightning. Like, this is what I want to do.
Wow. Oh, wait.
And so,
And you're 21. This is still 21.
yes, yep,
Okay. Okay.
absolutely.
Hmm.
Yeah. And so at that point, I literally the next day I went into school. I contacted my academic advisor. And I said, I want to go to chiropractic school instead of dental school. What do I have to do?
Hmm.
And thankfully, all the requirements were virtually identical. So I didn't really have to change anything as
Okay.
far as my classes. So, but I remember telling my parents, and my mom basically cried when I told her I wasn't going to be a dentist anymore.
Hmm.
And again, growing up in a small town, they heard the same stuff I did.
Yeah.
So they thought I was like committing career suicide probably.
Yeah.
And but that got me to chiropractic school. And then once I got into practice, I felt like most of the things that I was taking care of people for were sort of like self-inflicted problems caused by bad lifestyle choices.
Okay.
And even though I could help them, they never wanted to do anything on their own at home to stay better.
Hmm.
They would always develop this mentality of like, oh, I can just come in and have you crack my back when I don't feel good.
Hmm.
And it was like this like codependent kind of a thing.
Yeah.
And at some point, it's sort of like the definition of insanity, doing the same thing over and over, expect a
Over
different
again.
result, right?
Yes.
So at that point, you have an ethical conversation with yourself in the mirror to say, is this even really what I want to do? Because these people don't want to do what I'm asking them to do, and I'm not really fixing them.
Hmm.
I'm only kind of putting a band-aid on the problem. Well, over the time of seeing these people in my early years, they started bringing their kids in to see me for scoliosis. Local pediatrician finds it, but in where I practice outside of Flint, there's not a pediatric orthopedic surgeon for at least an hour to 75 minutes away. So a lot of these people will come in to see me because they're either on a wait list to see that doctor or they went to that doctor and that doctor says, well, it's not bad enough to do anything about, so we're literally just going to do nothing and watch and wait.
Hmm.
Well, no parent wants to do nothing, obviously. And so they would start bringing them in to see me. And even though that parent might have done absolutely nothing of what I asked them to do, now it's because it's their daughter and I give their daughter something to do at home. Come hell or high water, they're going to make sure their
Of
daughter does what
course.
I asked them to do at
Of
home,
course.
right?
Of course. Yeah.
Well, when that happened, all of a sudden the outcomes started becoming very surprising and consistent and rewarding, most of all.
Hmm.
And on top of the fact that scoliosis isn't a condition that you develop just because of bad lifestyle choices. I mean, it has a genetic component. I mean, kids who get it really are sort of a victim of their circumstance.
Hmm.
And so it just meant a lot more to be able to help somebody with a problem that they didn't ask for in that sense. You know what I mean?
Okay.
So
Yeah.
so that's why I do what I do. And then from that point, I switched my whole practice over to where I've been, out of the 23 years I've been in practice, I've run a scoliosis dedicated practice for about 18 of them.
Wow. Wow. Can you tell me what are the stats on people with scoliosis? So, if you know any stats, can you tell me? And I don't know if we're talking just
Yeah,
North America or worldwide, but do you have any stats that you
sure.
can share?
Sure. Yeah, typically the stats are worldwide. But when we start out as young kids, the depending on the author you read, it occurs in about 3 to 5% of young teens or preteens. But the incidence actually increases across the lifespan. And by the time women, for example, hit childbearing years, it goes from 3 to 5% up to about 20%.
Mm.
And then by the time women are postmenopausal, it's almost 2 out of 3. So it really, really jumps. And I say
Mhm.
women because as a condition, it affects women compared to men on the order of like 8 to 1. So it's a
Okay.
very, very female dominated kind of a problem. And most people think the reason that is because the times where a curvature is usually either first discovered or rapidly progresses
Hmm.
are during times of rapid hormone change, like puberty, pregnancy, and perimenopause.
Hmm.
Well, obviously, men aren't getting pregnant and men aren't going through menopause, so they're not having a lot of these life changes where these hormones rapidly evolve in a short period of time. And during puberty, Girls typically hit their main growth spurt at the same time they're going through all these hormone changes,
Okay.
whereas boys actually hit their growth spurt typically after their hormone changes have already been kind of changing over and kicking in.
Hmm.
So because they don't have that cross section like girls do in the younger ages, it's much more common to develop in a girl than a boy.
Hmm. So I think I thought that scoliosis, we call it genetics, Dan. I thought that, when you're a baby, you're born with it, but you're kind of saying that you develop it later on,
Absolutely.
in different stages in
Absolutely.
your
You
life.
you now
Wow.
you're not wrong. You can be born with it, but
Okay.
typically if you are born with it, it's
Hmm.
usually because you are born also with something else that
Hmm.
directly caused it. So
Okay.
for example, you could have been born with cerebral palsy, or
Hmm.
you could have been born with Down syndrome, or
Hmm.
something else that we know directly can cause a curve.
Okay. So you did touch on genetics and hormones, but does nutrition also play a role in this influencing
It does. It
scoliosis?
does. I actually was just commenting on a couple of studies here that on my own podcast, Scoliosis World, where just a study published last month
Hmm.
by the Journal of the American Academy of Orthopedic Surgeons that they are predicting that by 2030, based on the natural trends since the early 2000s,
Hmm.
that I mentioned 3 to 5% of teenagers is actually going to increase. In fact, it's going to almost double by 2030. And they
Gosh.
believe that the reason for that is twofold. One, the relative lack of nutrition and the diet that kids are eating nowadays,
Yeah.
and the lack of activity due to, everybody spending time on their phone or playing their electronics or whatever else.
Hmm.
So they're just, they're not like me when I was a kid and climbing a tree and being at
Yeah.
the
Yeah.
baseball field till dark and all this kind of stuff. Nobody does that anymore.
Hmm.
And that lack of activity is really taking its toll on top of the all the frankenfood that people eat
Hmm.
that is almost devoid of any kind of nutrient value.
Yes.
And of course, these things all kind of lump on top of one another.
You know what's crazy, Mark? Is like we're watching this in real time. So before I started recording, we're around the same age. And you see how we grew up. I was playing baseball, my brother, my friends, we were in leagues, in school, gym class, activities. And our parents would be making meals. I don't know if all families were like that, but we had dinner at the table and, nutrition as far as it can go. Your parents cooked well for you. But I think a lot of things have changed over the years, as you were saying. We're behind screens, we're on our phones, we're doing all the interactions to Zoom and all these social media platforms. And then it turns out that we're eating a lot of fast foods now. It's all about quick and easy foods to eat. And the development of, microwave foods back in the days, which we used to eat sometimes. But now I feel like it's worse. The processed foods and things that we're putting in when it comes to hormones. I think this plays a lot in any kind of condition or disease, right?
Agreed, 100%. And in fact, so when we do, because since we're kind of talking about genetics a little bit, so
Hmm.
when we do genetic testing in children who have scoliosis,
Okay.
some of the genes that we actually look at are genes that make it more difficult to properly process hormones. And then, so you already have sort of that genetic predisposition to having those problems. And then you lump on top of it hormones in dairy products or, estrogen mimicking hormones in plastics, microplastics, forever chemicals, all these kinds of things that we talk about now. And those all just add to the problem. But
Yes.
nobody ever really wants to deal with that. It's like everybody, or at least most people, have heard of BPA, and they try to take BPA out of plastics now to say BPA free because everybody knows that BPA is an estrogen mimicking hormone.
Okay.
But what people don't understand is that we get all kinds of BPA, even from like the shiny, glossy kind of receipts that we get like from the gas station pump or from a department store or whatever. Those have BPA in them, and as soon as you touch them, that's going into your body through your skin. And
Yes.
so we have I mean, our bodies just are bombarded on a day-to-day basis with all this, toxic soup and the world we live in,
Hmm.
that it's very hard for our body to kind of keep up and to function normally.
Yeah. Oh, well said. Well said. And you can see the increase in all these conditions. And people are saying, "Oh, I wonder why we didn't have the rise in cancer diagnosis and all these things that you hear about." Even in my company I work for, Medical Alert, we have a special ID for people on the spectrum, so autism.
Hmm.
And you hear that conversation, why the increase in autism? sometimes I want to see if you can touch on this too, even though it's away from scoliosis. I'd just like to hear your opinion. So sometimes I think, is there an increase in autism? Or is it when we were younger, we didn't see the signs? We seen the kids that, you think they have some kind of developmental issue or some condition, but you just don't know. And now we're putting a label on it. What do you think about that?
Sure, sure. What you hear that argument here a lot in the States too. It's like, oh, it's not that autism occurs more, we're just better at diagnosing it now.
Okay.
But I mean, intuitively, for those of us about our age and older,
Hmm.
it's like we didn't know. I mean, everybody might have had like one child in their whole high school who maybe was on the spectrum at the time. You know what I mean? Like we all
Hmm.
knew that quote unquote weird kid that we went to school with because he was the only one. Now the school it has all kinds of kids who are on the spectrum. And that can't just be because we're better at
Hmm.
identifying. I mean, the average person can identify that issue in
Hmm.
most people. You know what I mean? They
Yeah.
might not necessarily know it's an autism spectrum disorder thing, but you can tell when somebody's off in that manner, right?
Okay.
It doesn't take a Harvard educated MD to figure that out.
Yes.
But what has changed is and as politicized as it gets, it's true nonetheless, is, when you and I were kids, when we had our childhood vaccines, we had like 6 or 8 of them.
Hmm.
Now, at least on the US schedule, there's like 80 of them. Well, at some point, your body gets overwhelmed with all of the chemicals that they intentionally add into them to intentionally ramp up your immune response.
Hmm.
I have a nephew who has autism, and my wife and I could tell right away,
Hmm.
about 2 years old, it was like a switch flipped and just something was off about him.
Wow. Okay.
And we knew it right away. And his my brother and his wife, I think they were sort of maybe in denial about it or whatever because she's a school teacher.
Hmm.
But I mean, we could tell right away.
Hmm.
And I do think that that plays a role. Now, do I think it's the only role? No. But again, we live in a very, very polluted world nowadays.
Hmm.
And it's not just affecting the air we breathe and the water we drink, but it's in the food. I mean, we eat genetically modified food. We eat food that's, that barely passes as food. I mean, everything is so
Yeah.
ultra processed.
Oh,
And
I
so
know.
all the stuff just kind of feeds into one another.
Yeah.
And even like here in the States now, they just published the CDC published data showing that there was like a 1,200% increased risk of autism following a child getting, I believe it was the hepatitis B vaccine as an infant.
What?
So
Really? Mm.
I mean, again, a lot of these are associative factors, and that's certainly a different statement than saying a causative factor.
Hmm.
But again, that's also not the only shot they're getting either. They're getting a whole lot of the dozens and dozens of these shots if they stay on the schedule. And
Hmm.
I think it's just ultimately overwhelming the body and their nervous system. And a lot of the chemicals that they add in are specifically neurotoxic.
Yes.
And it just all lumps in. And if you have no way of dealing with all that, and maybe you're even genetically predisposed to not eliminating those things from the body properly,
Hmm.
now that lays the groundwork for, having symptoms come out.
So yes, I get that. You know what? Yeah, when I was young, all I remember is measles, mumps, rubella. I think those were the main things
Yeah.
that we. And then when my daughter was born, I think she had to get. Was it what's that shot that teenage girls get?
Like a Gardasil?
Yes, they in school they made her get that, and then you have the chickenpox vaccine and the
Right,
hepatitis,
right.
and then when my wife
Polio.
polio, and when my wife went into healthcare, she had to. I don't think her mom could find the record, so she had to get the same shots again, plus measles and different things. There's so many shots we're taking, but
Right, right.
I want to touch on something though. And maybe you can explain it in terms that I can understand and my audience can understand that don't know about this. But I used to watch a couple doctors on YouTube and the term epigenetics came up a lot.
Yes.
And I'm trying to understand it in the terms of what it really means in the body and the genes turning on and off. Can you explain epigenetic and how it plays a role in scoliosis treatment?
Yeah, absolutely.
Hmm.
Absolutely, because it absolutely does. So going back to the early studies of genetics with scoliosis, there was a time where everybody was trying to just find that one gene that causes scoliosis so that, they can isolate it, identify it, do some type of gene therapy, and then eliminate it, right?
Hmm.
Well, the problem becomes that when you start looking into literature, it wasn't too long before all of a sudden they've published, 3 dozen different genes that are all supposed to singularly cause scoliosis.
Hmm.
But the problem is, how can all of those be true? How can all of those singularly cause scoliosis?
Hmm.
And then all of a sudden, the advent of epigenetics came out. And really, what that means is that epigenetics are essentially the nature and nurture concept, meaning I have to have predisposition. It's sort of like when I explain it to my patients, what I say is it's almost like the scratches on a record. And of course, obviously, I'm dating myself using
Yeah.
that analogy, but
Yeah.
obviously, when you have scratches on a record, every time the needle passes that scratch, it messes with the sound.
Okay.
But if I keep that record waxed, then it doesn't mess with the sound. Well, waxing it is taking care of all of the environmental components to keep the sound playing well so that that scratch doesn't have an impact on my physiology. But as soon as I start neglecting it, like I'm not doing things to detoxify myself, or I'm not getting enough physical activity, or I'm not getting enough of a certain nutrient,
Mhm.
now it's going to be easier for that scratch to have a day-to-day impact on my health.
Okay, I get it now. I get it. Um, Take me back for a minute though. You told me about your path into clinician, like what you're doing
Yeah,
now. But when you were a kid, did anyone have an influence on you to go into this field of medicine, healthcare? What were you looking at going towards when, say, you're in high school for?
sure, sure.
Mhm.
Well, actually, so again, going back even to my high school years, I initially was going to go to dental school to be an orthodontist,
Oh, okay.
but for all of the wrong reasons because I was totally Willy Wonka when I was a kid. I had the headgear, the braces, all the stuff for like 5 years of my teenage
Wait, let
years.
me stop you there for a minute. Because we grew up in the times where we had to put the headgear and it wrapped around our.
Yeah, oh yeah.
Yeah.
Yeah, that was me.
Okay.
That
Okay.
absolutely was me. And so because of that, for 5 years of my teenage years, I was in the orthodontist office, every 6 weeks to get a checkup.
Yeah.
So being in the orthodontist office was just like second nature to me by that point. And I remember always sitting here thinking, I'm like, So I go into my visit with my orthodontist,
Mhm.
and he's in this visit with me personally for all of 5 minutes. And it's his assistant doing all the work, changing my wires and, rubber bands and all the things. And we walk out. I remember every time we go, my mom's paying like $200.
Yeah.
And I'm like, man, this guy sees me for 5 minutes. He makes $200. This is what I want to do.
Yeah.
So obviously it had nothing to do with helping people. It was all for the wrong reasons.
Hmm.
But I did, it was, like I said, it had become so second nature to me from being there all the time. I hadn't really thought about doing anything else because I was practically living there
Hmm.
for my formative years at that.
Yes. Yes. Yeah, I remember. I had the braces. I don't remember the amount of years, but you have the braces and you get them tightened every time you go to the appointments. You wear your headgear at night. We had to keep track of the hours too. You had to write
Oh
down like
yeah.
8 hours a
Oh yeah.
night. But the feeling of taking the braces off and then seeing your teeth being straight, it was an amazing feeling. I gotta ask you though, I don't have the wire. My daughter had braces too, and she still has the wire behind her teeth, but they took it out. So my teeth has separated since then, and I
Hmm.
got space on my teeth again. But I don't know if you have a wire behind your teeth.
I
Or,
don't. I don't.
uh,
They did actually. I didn't ever. Only had to wear a retainer when my braces came off for like 2 years afterwards, and then I was done.
and then you were done, and you don't have problems.
I don't have a problem.
Oh, you're
Nope.
lucky.
Knock on
Lucky.
wood.
Yes. Okay, back to scoliosis. So, what is it like when a family comes to see, say you, right? To get that diagnosis? Because I don't know if I read somewhere, because I was doing a little research. Is there a wait and watch period where you don't do anything, or like what is it like when someone comes to see you?
Yeah, that's actually kind of the hard part, right? So as a chiropractor, most people who come to see me have
Mhm.
already typically been to see the orthopedic surgeon first.
Okay.
And in the conventional treatment pathway, it's usually a pediatrician that discovers it during like a normal well child, annual visit or twice annual visit. And then they send them for an x-ray and then they refer them out to the orthopedic surgeon.
Mhm.
Depending on how severe the curve is at that time, Typically speaking, if the curve is less than about 25 to 30 degrees, most orthopedic surgeons are going to kind of do nothing. They're just
Okay.
going to say, look, we're just going to watch and wait because it might not get worse. So we'll just monitor you every 6 months. And if it gets worse, then we'll put you in a hard brace.
Okay.
And then if it continues to worsen up to the point of, at least lately, more recently, it's the surgery threshold's about 50 degrees, then we'll do surgery to straighten it. But the problem becomes most parents, like I mentioned earlier, when you're in that watch and wait kind of stage of care, if you even
Hmm.
call it care at that point,
Hmm.
that no parent wants to do nothing. Parents
Yeah.
feel helpless when, they see their daughter's back or their son's back, and the doctor has told them, well, we're not going to do anything.
Hmm.
Well, why not? Because especially if a curve is only, say, 10 or 15 degrees at the earliest stages of scoliosis, that's the best time to get in there and actually improve it and resolve it and give it a chance of actually correcting it 100% so that they don't have scoliosis anymore. But the
Hmm.
problem is they don't, and they wait until it's 25, 30, 35 degrees before they initiate treatment. And now the ability to improve the curve goes down dramatically.
Hmm.
So a lot of parents who are in that watch and wait mode come in to see me to say,
Hmm.
look, we want to do something.
Hmm.
Now, the difference in what we're doing then is we're doing a lot of other things on top of just physically treating the curve. Because it's a lot of these other things, like I mentioned before, with the genetic risk or the epigenetic predisposition, their nutrient status, their hormone status, all of these things are what make it easier for that curve to become progressive when they hit their main growth spurts. So if we can eliminate all of those things as what stimulated the curve to start in the first place, it's much easier then for the physical treatment of the curve to produce a better and more long-lasting benefit.
Hmm. What's sorry, what's one of the worst cases you've seen or most?
Well, I've seen kids, I mean, we've seen kids in the hundreds of degrees of curve.
Wow.
And of course, obviously at that point, their options are far more limited as far as physically treating the curve.
Hmm.
But one of the other things that we do now that's nice is that I know there are a couple places in Canada as well, but there's a newer version of a scoliosis surgery called vertebral body tethering,
Okay.
or just scoliosis tethering, some people call it.
Hmm.
And it's not a fusion surgery, meaning it's not fusing your entire spine. It's actually putting in like an internal brace for ease of description. But it keeps your spine independently flexible, unlike the fusion, which converts it all to it's like basically turning you into a human telephone pole.
Yeah.
And so it's a way better surgery. The problem is there aren't as many surgeons in North America who are trained to do it
Hmm.
as compared to the conventional one yet. Now that'll change eventually.
Hmm.
It's just we're one of the early adopters of referring for it.
Hmm.
And there in all of North America, there are probably really only maybe 20 to 25 doctors that are doing it with any regularity.
Does this have to do like I think another thing I read about you have a lot of peer reviewed research and going against your traditional approaches. Is this one of the things when you put things out there to get that peer review, get that, I don't know if you call it accreditation or what you would call it, but can you talk about some of your peer reviewed research that goes against that
Sure,
traditional
sure.
approach?
Yeah, I think any time you're trying to use a disruptive technology, you have to make sure you have some type of credibility behind it.
Hmm.
And so the best way to do that is to publish research that people will take at face value.
Okay.
And but the interesting thing is with a lot of what I'm doing, it's actually not most of the research that validates what I do is not research that I myself have published.
Hmm.
I mean, some of it has certainly, but I mean, there's research on this stuff going all the way back into the mid 1980s. I think the real problem with some of this stuff is that, a lot of this work involves getting into like serotonin and melatonin production and hormone metabolism and all things that orthopedic surgeons don't do anything with because
Hmm.
that's not their specialty. But yet it's the orthopedic surgeon who is spearheading the management of this condition 99% of the time.
Okay.
And because that's not in their wheelhouse, they're not doing anything about those things. So a lot of this research out there is just sort of like academic based research, not necessarily clinical research. And it's not like an orthopedic surgeon is going to know how to manipulate a girl's progesterone level or melatonin level, things like that. So they frankly just that research gets ignored or lost.
Hmm.
even though some of that research has been published for, going on 40 years. And so, to me, that's a real shame because I think if you can resolve a lot of that stuff right from the outset of care, the child has a much better chance of getting a long-term success in improving their curve, not just trying to even keep it the same where it's at, which is usually the traditional goal. And so with having that peer-reviewed research out there, it gives a lot of third-party people to say, okay, Morningstar isn't just some quack charlatan who's
Yeah.
selling snake oil to people. There
Hmm.
is data to support what they're doing. And yeah, that data, of course, is going to have its own limitations, but I'm at least not afraid to put my data out there and see where the weak points are in that data to try in an effort to keep moving everything forward because we owe it to kids to try to keep making this better, not just do the same thing we've been doing for the last 80 years.
Right. Yeah. What I'm learning now, and it's so, I think you saw when I had my chiropractor on. It's like I'm relearning so many things from, I mean, what you call them, new age doctors, not your traditional doctor that I grew up with back in the day. But I'm learning so many things that are going against, not against, but different pathways of treatment when it comes to medicine and understanding about certain conditions. And I think what I just learned from you too is there's a critical window in adolescence where you can really help treat scoliosis.
100%. And the problem is that window really gets ignored conventionally. And
Hmm.
so you lose that little window advantage of opportunity. And once it's gone, it's gone.
Yeah.
And you can't get it back. And that's the hard part.
What is, we talked about surgery there. What is your opinion on surgeries in general? We could talk about
Sure.
scoliosis, but you know how when I had this shoulder issue, I thought I was done. It was one of my rotator cuffs. And my chiropractor, there's no tear. I had a CT scan. Is a CT scan, I think it was, or X-ray, whatever it is. And no tear, so I'm good. I think a CT scan. But he was telling me about surgery. Like once you have surgery, sometimes you're not going to heal. It's not going to be the same, like healed the right way. It's not going to be the same. You won't have the same movements and things like that. And sometimes you feel like surgery is like a worst case scenario. Sometimes it has to be done in certain conditions. But
Sure.
when it's something like a knee injury, your hip, your this, what is your feeling on surgery in general?
Sure. Well, I agree with all of that. I mean, I think surgery obviously should always be the last resort to
Okay.
anything.
Hmm.
But I'm not necessarily against surgery. What I am against is the overuse of it, especially in a fee for service model.
Okay.
Um, obviously at the end of the day, and again, orthopedic surgeons are doing what orthopedic surgeons are trained to do, but obviously the reality we run into, especially in the States, is because we have a fee for service healthcare system,
Hmm.
it's still a business. And I feel like the pessimistic side of me says if I have if a child where I could do surgery, maybe they're on the cusp of being at that surgery threshold, um, do I want to do the surgery and make $250,000 or continue to have them wear a brace that costs $3,000?
Hmm.
You know, and everybody hates when you talk about that because nobody wants to look at it that way, but that's the reality. I mean, medicine is still a business in that sense. Now, for me, I think more specifically to scoliosis, I think scoliosis surgery is really the ultimate necessary step when and if there is a distinctive health problem because of that curvature.
Hmm.
So, as an example, typically when somebody has a curvature, they're either going to usually have a heart or a lung impact from that curve.
Okay.
And so, if the curve gets bad enough, it can start to decrease their lung capacity, for example,
Hmm.
or it can cause a heart arrhythmia. Things that are organic health issues that now you have to, you really have to do something about because if it cuts my lung capacity in half, that also has a real chance of shortening my lifespan now.
Right.
So obviously, in that case, I have to bite the bullet and have the surgery. I mean, there really is no discussion there.
Hmm.
The problem, though, is that in the United States, the surgery threshold is about 50 degrees.
Hmm.
However, statistically speaking, Most heart or lung implant or impacts don't occur until a curve reaches 80 to 90 degrees.
Okay.
Now, that's not to say that they can't happen at 50 degrees or 60 degrees or less than that. But the nice thing is that those things are measurable. So if I
Mhm,
have a patient, and let's say they come in to see me and they have a 50-degree curve and they don't want to have surgery, well, I could send them for pulmonary function testing, for example, to
mhm.
see what their lung capacity is, what their VO2 max is, and all of these lung measurables to see if there's anything being impacted by their curve. And if there's not, then there's not a medical necessity to have that surgery. It's really at that point just a cosmetic process.
Okay.
Now, if they are having if it's cutting their lung capacity by 2/3, or now they're having all kinds of asthma reactions because of the size of the curve, what have you,
Mhm,
well, then now that's a different discussion.
mhm. Okay. Okay.
But
You-
short of that, as long as families, and that's not to demean the value of cosmetics
mhm,
and cosmetic appearance,
mhm,
but at least then families and that patient can go in eyes wide open,
mhm.
knowing why they're having the surgery before they decide.
Yeah, it makes sense. Thanks for sharing that. You know, when you were talking about that spine fusion surgery,
Yeah.
what
Yeah.
I don't know if this is a dumb question, but just from my knowledge, I want to know. I know a couple of people that had their hip replaced, knee replaced. My CEO actually had her hip replaced, I think a couple years ago now. She was trying to, and I didn't know about this. She was trying to prolong it age-wise because she said you're gonna have to replace it again. I forgot the amount of years. So in terms of spinal fusion, did I say that correctly?
Yes.
Like when you have the spinal fusion, is there something where it's like you have to go in for repeated surgeries? And is this painful to the person that has this condition?
Sure. Yeah. Well, statistically, at least most of the time, the hardware that's put in, because bear in mind, most of the time when teenagers are having this surgery, they're having it at, 12, 13, 14 years old
Okay.
most often.
Hmm.
Well, the hardware itself really is only going to give you about a 20 or 30-year tread life.
Hmm.
So at some point, that hardware is going to corrode and fail, and you're going to have it replaced. So the vast majority of people who have scoliosis surgery as a teenager are typically going to have it repeated at least once again in their lifetime,
Okay.
just because the hardware goes bad, just like a hip or a knee replacement.
Okay. And you know the new technique you were mentioning where not a lot of doctors can perform that. Would
Right.
that be a different outcome or the same kind
It
of
is a
thing would
much
happen?
different outcome. And
Mhm.
the reason, and it's not to say that, because again, the tethering and the hardware for that surgery can, wear out after a while too.
Mhm.
But the procedure for replacing the tethering is far less invasive than having to repeat the whole fusion surgery over again when that hardware goes bad.
Okay. Hmm. Very interesting things. Very interesting. What's one thing before I ask this question, you know the empathetic side now, emotional side. Did this come natural for you? Because I can see a family coming to see you and son, daughter might be upset that they're going through this. Did you naturally learn how to be empathetic in sharing this information? Because a lot of us, when we hear terms from doctors, it's like, okay, I don't know this medical jargon, so you have to bring it down a little bit, right? My
Sure,
daughter's
sure.
actually in vet school. She's in her third year vet school. And
Oh, cool.
and she was telling me about this, where she has to do like mock interviews with the dog owner, cat owner, and you have to learn how to use the correct language because they use like the language, right? So anyway, I guess I'm asking a two-sided question. Is it easier to you to relate to someone and be empathetic because you've done this for so many years? Did it come natural to you?
Um, yeah, although ironically, I think all of that's true, but I don't even know if it would be to say it's because I'm empathetic about it. I almost feel like when I'm in that room with a family,
Hmm.
I usually end up talking more directly to the teenager with the problem than I do the parents. Because I think a
Okay.
lot of times, and parents tell me this all the time, their experiences with, conventional providers is the surgeon might walk in and just start, throw up an x-ray or put it on the computer screen and say, okay, this is the curve measurement. We're going to do nothing. And there might be in and out in 5 or 10 minutes.
Hmm.
And they're not even really acknowledging anybody almost.
Yes.
And, obviously bedside manner to me is huge. Well, I would rather my goal ultimately, especially for what I do in the realm of scoliosis, that child is going to have to put some skin in the game
Hmm.
if they want to get better and stay better. So right away, I don't honestly, what the parents think is sort of irrelevant to me at the start. I
Okay.
need that child to be on board with what is going to happen so
Hmm.
that they are in control and not even in just during their teenage years, but scoliosis is still a lifelong condition, no matter how much you improve the curve.
Hmm.
So I have to get them on board with the realization that you're going to need to develop lifelong strategies to battle this and improve it so that it doesn't become an issue or become a far worse problem later on when you're not 13 anymore, but you're now 70.
Yes.
And if you don't want to have a lot of issues, then these are the things that we have to do now to prevent those things from happening. So, which is why I'm big on analogies. Like I mentioned, the scratches on the record and all this.
Yeah.
I'm big on using analogies for a lot of this stuff because it's what kids understand.
Yeah.
I speak in a lot of, fifth grade language in that sense, just because I want everybody to fully appreciate the why of what they're doing. Because again, for me, being the disruptive technology part of this,
Hmm.
I'm the black sheep in the sense of conventional medicine. So I have to, I have known over the course of time from experience that I have to be better about explaining the why of what I do versus just somebody walking and saying, well, this is what we're going to do because it's the standard of care.
Yes. Hmm.
And my thought on that has always been, well, what if the current standard of care sucks?
Hmm.
Or maybe it's incomplete. Like I think in the case of the watch and wait, because no, like I said, no parent wants to do nothing.
Right.
And there are
So,
things that are available out there for them that they just might have not been made aware of. Sometimes unintentionally, sometimes intentionally.
so true. So true. Thanks for sharing that. Because I remember when I was talking to my chiropractor, the way he explained that adjustment, that pop, I was like, yes, use terms that I understand. And I'm like, this is amazing how you explain. And it seems like you do the same type of thing. When you explain the record scratch, I understand it more, when you explain these things. And I think kids and teenagers would appreciate that explanation so they understand in their own way on what's going
Right.
on with them and the treatment that is to come. Have you treated someone for a number of years where you're like, oh, I treated her, him at like 12 years old, and now they're in their 20s. Do you have any experiences like that?
Yes. Yeah. I mean, sort of in a funny way, sadly,
Mhm.
I've been in practice long enough that I've treated kids who have now come in to see me to bring their kids in to see
Oh,
me.
are you serious?
So yeah, because of course I treated them for scoliosis when they were, a mid-teenager maybe, and
Yeah.
now they have children of their own and are bringing their children in to see me. But the cool thing
Hmm.
is that because I, at least in retrospect, I must have done a good enough job explaining the why of what I was doing,
Hmm.
that now they understand, hey, look, I'm going to bring my daughter in before they even ever have signs of a curve.
Hmm.
Because now, if you do all the same testing on them that you did on me, and we start addressing all the stuff, maybe she actually never actually develops a curve.
Okay. Okay.
And now we're
Nice.
actually preventing the curve altogether.
Nice to hear.
So it is
Um,
come full circle in a certain sense.
it's full circle. Yes. You know what's cool? My mom was in nursing at Women's College Hospital here in Toronto, 30 years. My mom's 90, 91. You know what's funny about this too? Anytime I do a podcast and I tell my parents, I mentioned you and I said your age, they're like, why do you keep talking about my age? But my mom was in delivery suite. Like she helped deliver babies, right? Oh, Peter and your memory. Why did I bring this up? Oh, she delivered many, kids, and it's the same type of thing. She was there long enough where someone that she delivered is now having a baby. So there's so many stories.
Right, right.
Um,
I
I
feel
have
like
a
it's a teacher who has a kid, then they have their kid later
yeah,
on when, yeah, yeah, same thing.
yeah, I've heard that many times. One question that I ask a lot of my guests, and I want to see what you say too. Before I get to this, would you rather question? Do you have any teachers in your past? I like to talk about like even public school. We call it public school, junior high, high school. I don't know if it's the same in the States, but do you have any teachers that negatively influenced you or positively influenced you that you can never forget and you know them by name?
Oh yeah, Mrs. Spidell. Absolutely. She was my eighth grade literature teacher.
Hmm.
And so we were reading, I believe it was Huck Finn at the time.
Hmm.
And I was never a big reader when I was young. I hated reading, frankly.
Hmm.
Um, and so I remember being in her class and essentially just trying to read the Cliff Notes books that they had back then
Yeah, yeah.
on the things.
You remember that?
So, I got called on in the middle of class to answer a question about something in the book, and I gave her the Cliff Notes answer, and she obviously picked it out, as obvious,
Hmm.
and proceeded to yell at me in front of the class and tell me that if I didn't learn to read books, I was going to amount to nothing as an adult,
Oh,
and
wow.
then sent me out in the hallway for the rest of class.
Hmm.
Well, I never forgot that because then years ago, when I wrote my first book on scoliosis,
Hmm.
I actually acknowledged that
You,
in my acknowledgement in the book.
yeah.
Yeah, maybe I never read books a lot, but here I wrote one. Thank you.
Wow. I like that, Mark. I like that. You know what's different from us? Like when we grew up, we didn't have social media, right? Facebook and all that
Right.
stuff. So I would love to see some of my teachers from back in the day. We don't, oh, what happened to Mr. Fisher, Mrs. Whitaker? We don't know. But a lot of the kids growing up now, they still know their teachers because they're on social media. And I've had people on my podcast, 20, 30 years old, and they tell me the positive story about a teacher. And they're like, yeah, I connected with them on Facebook. And I'm like, wow. Like, once we were gone from school, it's like, I haven't heard anything from these teachers. I don't even know if they're alive, a lot of them probably, but yeah.
Sure, sure.
Mhm. Okay, before I ask this would you rather question, this is what I want to ask you. How is the curve? Because you've been dropping 50% curve, 25. How is that measured? Is that a good question to ask? Because I don't, how do you measure
Yeah,
that?
absolutely.
Hmm.
Yeah, so nowadays, because most all the X-rays taken are digitally on a computer,
Hmm.
the computer usually has a software program where you're just picking points on the X-ray within the curve, and
Okay.
then the computer automatically calculates the measurement in degrees. So, if I have a curvature, for example, I'm picking the vertebra at the highest point of the curve, and
Okay.
the same thing at the lowest point of the curve, and then the computer is just measuring that angle in degrees.
Oh, okay. So there you go. Okay. Um, Now I got a would you rather question. Thanks for all this info. This has been great so far.
Yeah, absolutely.
Let me see what you would say to this. Dr. Mark Morningstar. What would, no. Would you rather visit your younger self and give them advice for the future? Or would you rather visit your older self and have them give you advice for what's going on right now?
Oh, that's easy. I'd rather go visit my younger self because I
Okay.
would I would go tell him to buy Bitcoin.
There you go. I- I've heard that. I've heard that so many. I heard that so. Oh, beautiful. Yes. And and we're old enough. Sorry, I'm still I'm stop laughing, Peter. Stop it. I mean, we're old enough to remember when the IPOs came out for certain companies too, right? So
Sure,
your
sure.
Walmarts, your Amazon, all these companies that
Right.
we could have
Even Facebook.
Facebook, yes. Yeah.
Yeah. Yeah.
Hmm. I remember when that one actually the IPO came out. I was working at this company called Celestica, and my friend bought some stocks. Yeah, 1997, 98, or something like that, or 2000. Okay, whether my guest chose their younger or older self, these four things have to do with your younger self. And I'd like to
Sure.
hear, you're a doctor. I'd like to hear your perspective. What would you tell your younger self about money?
About money? Well, first off, I would go because it's the same thing I try to teach my sons now is that money is a debt instrument. And you need to use money to acquire assets so that because assets are what really give you freedom. If you're always going after money, that just means you're always going after debt and you're always going to have to be chasing it. I want to, I would tell my younger self and I teach my sons, if you acquire assets, then someday you can do whatever you want to do without having to work for a master.
Mhm. Did you learn money and the value of money and investing on your own, or do you acquire from someone else?
A lot of time spent on my own, following different, like the Robert Kiyosaki's of the world, the
Yeah.
Rich Dad, Poor Dad,
Yeah.
that was my initial foray into it probably. But um, listening to a lot of the crypto people along the way before it was really what it is now.
Hmm.
Um, yeah, just trying to learn from, I think one of the big problems we have nowadays is we don't celebrate successful people anymore. We don't try to aspire to be successful people anymore. We
Hmm.
always try to tear down everybody who's successful or envy is a big problem in that regard. So
Hmm.
I always still try to teach my sons, look, if somebody out there is better than you are,
Hmm.
and there's nothing wrong with admitting that, but the goal becomes to learn what they did to get there and
Right.
become them.
Right.
And you have to surround yourself with people who are better than you because it's going to make you better. And the same thing happens in reverse.
Well
And
said.
money is just one of the core things with that.
Well said. Well said. What would you tell your younger self about friends?
Friends, well, funny enough, I would say, at the end of the day, I think what people call friends when we're 20 are
Mhm.
different than what we call friends when we're 50. And like my younger self, I could have said, hey, look, by the time you're 50, your friend's basically going to be your wife.
Mhm.
And
So
that's,
true.
because in the true sense of that, I might have like, my wife and then maybe one or two other people I can really depend on, count on that I would, call true like friends in that regard
Mhm.
versus now I just call most people acquaintances.
Mhm. Oh, that's true. That's so true. I'm more of a homebody now. We used to go out so many times. We go out together and still go out, but I like being home now. It's so different how my life has changed. And spending time with my dog there. Okay, thanks for that answer. Two more. What would you tell your younger self about family?
If you don't have family, you don't have anything,
Mm,
honestly.
mm,
I mean, at the end of the day, it's what I live for. It's, you have to keep your family in priority because, I have, my oldest is a senior in high school. He's going to be going off to college next year to play baseball.
mhm,
And it's like I try to tell him, look, the only people you can truly depend on are the people in these four walls, and
mm,
that's it.
mm,
And that's going to be, and carry that with you someday because someday you're going to have a family of your own and you're going to want to think that same way about them as I
mm.
do about you guys.
Yeah. Wow. Dr. Morningstar. This is great. One more. But before I ask you, it's so true, Doc. When my daughter was young, my wife and I instilled these values in her from beginning and made everything about family. She's great with my parents, grandparents, my wife's mother because her dad passed away. But she's great to the grandparents, great to her friends. But it's everything we instilled in her about love and just caring about people. And this is why she wanted to really get into vet school because she got her psych degree already, but
Wow.
her last year of psychology, our dog, not this one, Abby, she ate chocolate and then she had pancreatitis. And we tried to save her. We spent so much money. It was our first dog. And it's so sad. The way some vets speak to you, I think this is why I asked you about empathy too. Some vets are just like, telling you what's going on with the empathy missing. But this one doctor that talked to us, my daughter was there. And the way she explained to us, because we didn't know about, there's a choice you have to make. Euthanize your dog. I didn't even think of that, but she put what is it called behind it? It's better for your dog. She's suffering, right? And the way she
Yeah. Yeah.
explained it to us, something clicked in my daughter. And that was 4 years ago. And she came to us and said, I think I know what I want to do. Just because of that moment. And
Wow.
she got her psych degree, applied to vet college. There's only one here in Canada, Guelph University. And now she's
Okay.
in her third year. And it's like amazing to see. But it seems like you did that too, instill these values in your kids, right?
Sure. Yeah. And I feel that I had that same moment she did, like I mentioned earlier. That's why I'm doing
Yes.
what I'm doing. We have that moment. Yeah.
Yeah. Um, that you said piano, right? It was a piano?
Piano.
No, what were you lifting again? Was it what was it
Oh
again?
yeah, it was a piano. Yeah.
Yo,
Yeah.
if you're talking those old pianos that we used to know, oh
Yeah.
my,
No, it was I mean, it was a smaller version of a piano. Obviously, we had to take it down a wide flight of stairs, but still,
yes.
uh, it wasn't supposed to be that way. It ended up there were supposed to be four people on the job that day, and it ended up just
And you're
being
the
two of us.
oh my
And it's
gosh.
just like, all right, well, I want to go home. Let's get this done.
Yeah.
Yeah, and that's what set it all in motion.
Nice. Okay, last one. What would you tell your younger self about love?
Good question. I think at some point you don't have to worry about going out and finding it. At some point, you're just going to know.
Mm,
It's like, my wife and I both have a similar story in the sense we both dated somebody for a long time, like through high school, early in college.
mhm,
But I can remember, and I was with my friend at the time in our chemistry class. I was sitting here next to him, and this woman sits in the row in front of me.
mhm.
And I just couldn't help but I just stared at her the whole time. Like I didn't even know what the teacher was saying. I was just staring at her the whole time, right?
Yeah.
And I looked at my friend and I said, I know this is going to sound just entirely nuts,
Mhm.
but I'm telling you, I think that is a woman I'm supposed to marry.
Whoa.
And I had no idea. I didn't even know her name at that point.
Yeah.
And, here we are now married, almost 26 years later.
Wow.
So, yeah.
What a story.
Yeah. And
Amazing.
it's like, you know what? Don't worry about love. Don't make it work. It just works.
Yeah.
I mean, a lot of people talk like they're people get like caught up in trying to, oh, I need a person who does this for me and this for me and this for me. You know what? At some point, if the person just really loves you, they
Mhm.
love you for you. And you know what? Everybody's got baggage,
Yeah.
but you know what? It's just baggage you can live with
Mhm.
because you want to be with that person.
Nice.
It's like my wife, we have a sign above our bed that says Anam Cara, which is Gaelic for soulmate. And
Okay.
that's just how I feel about it.
Yeah.
When it's right, you're not going to have to try. It's going to be almost feel like the easiest thing there is.
Yeah. You know what's crazy? That's my wife and I too. And we're
Hmm.
close we're on 25 years in December. So around the same amount of time. Wow, you're right. You're so right. Thanks for sharing that, Mark. The last two questions. I actually had one here because if anybody is listening to this, I think this is one thing I want to ask you for sure, right? For someone listening who feels overwhelmed by scoliosis, the diagnosis, what's the first empowering step they can take?
Sure. So one of the things that you can do is first of all be proactive. So don't just settle on knowing what the curve is. Understand everything about you or your child, depending on who that is, as to why that curve started in the first place. Because getting all of that information and then putting that into an actionable plan allows you to now be in control of the process versus being a victim of the process. And if even just doing that, it helps, even from my perspective, it allows me to develop a treatment plan based on all of that foundational kind of information to know how aggressive do we have to be with treatment, or can we be a little bit more passive and because there really is no risk involved with this curve or what have you. But knowing that all that information is very, as a parent, very comforting, first and foremost.
Mhm.
And as a provider, clinical provider, it's very empowering to know that we now have control of all facets of this problem.
Okay, nice. Thank you for sharing that too. And just let people know before I get to the last Star Scorpio question, where do you practice? I think we mentioned it before recording, but share any information you'd want people to know about you. Plus, you have the podcast too, so share your socials and where you practice and everything.
Sure, sure. So, like I said, I have the Scoliosis World podcast. That's on YouTube or on pretty much anywhere you get your podcast from. My main clinic website, I practice in Grand Blanc, Michigan, which is outside of Flint, which is just scoliosispractice.com. And then I also run a company called Back Genius, which is a consulting company where I teach a lot of other doctors how to do what I do in terms of creating these kind of comprehensive scoliosis treatment plans for their patients.
Yeah, you know what's funny? When I did my quick research on you, sometimes I want to learn from my guests, and this was one of those opportunities. So I don't do a lot of research, but I think that's what came up. I saw Back Genius, so I'm like, oh, I forgot to ask you about that one.
Yeah,
Okay.
absolutely.
Okay, Mark, before we do our my donations that I do every episode is one more question. Do you want me to read out the Blue Jays or the Raptors?
Well, we're a baseball family, so I'll go to the Blue Jays.
Let's go. Did you see that game? That last game? Was it game seven? Oh my. Blue
Yeah,
Jays
game seven.
versus.
I know we were pulling because my son, I mentioned he's going to college. He's a catcher, so he's a big Alejandro Kirk fan too.
Yes.
And so yeah, it was. I mean, it's literally like one at bat away from going to the World Series, essentially. Ugh.
Yeah. Okay. What is one of the most memorable moments of your life?
The most memorable. I'll do two. The day I married and met my wife.
Mhm,
I mean, it's kind of all to me a blur, but I would say the moment that I said I was going to marry my wife, that always stands out to me.
mhm.
And then the moment that I became a dad,
Oh,
that was
yes.
that was big for me too. Just because and my wife and I had been married for let me think. We were married for 8 years before our oldest son was born.
Mhm.
So we had a lot of time together, but it was, all of a sudden you introduce a child into the mix and it's just like earth shattering.
Yeah. Yeah.
But thankfully, I'm glad we waited because we got to have a lot of life experiences together while we were young and, could travel and do things.
Mhm,
But when he came into the mix, as a little bit older dad starting out,
mhm.
it was awesome.
Yeah. Nice. This has been great, Mark. Um, the last thing I do on Real Talk is the donation to one of the causes that I always contribute to.
All right.
So, let me get these in my hand. So, I donate to four causes. The
Sweet.
fundraiser warriors. You see the shirt here. Four little boys who raise money for Sick Kids Hospital. I'm sure you were when you were in Toronto. You knew about Sick Kids Hospital down here
Yeah,
in
yeah.
Toronto.
And we
Yeah.
have a lot of patients that I consult with that go to sick kids for their
Oh,
braces and stuff for scoliosis. So yeah.
oh, amazing. So
Yep.
fundraiser warriors. Liam's mission. He was born with cystic fibrosis. And him and his mom do amazing things. They raise money for charity. Can't forget about the animals, so I donate to Claws, Kawartha Lakes Animal Wellness Society. And the last one is Juku Sports. My friend has a day camp for kids doing amazing things. All four great charities. Now,
Wow.
by my hands, which one do you want me to pop so I know who I'm donating to? One, two, three, or four?
Got it. Well, I'm left-handed, so I'll do your left hand, and so let's go two.
Let's go. All right. Episode 114 with Dr. Mark Morningstar. Star Scorpio will be donating to. Oh my. What is this? What are the odds? I know people can't see it when I pull away, but those are the four boys, the fundraiser warriors. Oh, and I'm wearing the shirt today.
That's
Amazing.
awesome.
Mark, thanks for being on the show today. I really appreciated it. I learned a lot about scoliosis, what you do, and how you help people. Is there any last words before we sign off?
No, I just sincerely appreciate you having me on, and congratulations to the fundraiser warriors.
Amazing. This is Real Talk with Star Scorpio, and we out.